Hi, my name is Marty Crittenden, and I am the clinical manager with Willamette Valley Home Palliative Care. If you or a loved one has been diagnosed with a serious illness, we'd like to talk with you about a program called Home-Based Palliative Care. It's an extra layer of support provided in the home for patients and their families when facing serious illness. So now let's meet palliative care coordinators Dawn and Kelly. They'll be able to help you with any questions you might have regarding home palliative care.
Home-based palliative care is an opportunity for medical professionals to go into a patient's home and help them through their serious illness.
Our program provides clinical team that it's an added layer of support that comes in and supports the patient and the family.
We have a nurse that will go and do a medical history for a patient, see where they are with their goals and their serious illness, and define what a plan of care looks like between the primary care physician or specialist and the family.
There's also a social worker involved who's going to help with community resources and also advocating on behalf of that patient.
And they design a plan of care that talks about what their goals are and what does it look like for them to get through this serious illness.
So we're not taking over the person's care, we are just an added layer of support that comes in and walks alongside that family.
It's quality of life for our patients. So for some patient, their goal might be to just get their symptoms under control, and so we're here to help them facilitate what that looks like. So we're here to help them with their symptoms and make sure that they're getting everything that they can, or find alternatives for helping. So if it's pain management, maybe there's a way besides opioids that might work for them.
Hospice is end-of-life focused. We're not doing treatment, life-prolonging treatments anymore. It's more like the disease has taken its natural course. With home-based palliative care, someone could be on our service for a very long time or a very short amount of time. It's more goal identified.
For instance, if it's a chemo patient, or a cancer patient, they might talk about chemotherapy and what that looks like and what their options are. Whereas hospice, they have decided that those things aren't going to work for the patient any longer.
Having clinical advocacy between yourself and your doctors is an amazing benefit, and also having the social worker available to you to help you with community resources, emotional support, things like that. So when you go to your doctor, you might have a limited amount of time to spend with them, whereas when your palliative care team is visiting you at home, they get to see you in your element, what is working, what is not working, what could be helpful for you and making you successful in your treatment or your journey that you're going along. We would receive a referral from an outside doctor, probably someone's primary care physician. Sometimes it could be the hospital. They're going to send us a referral saying, I think this person could benefit from your program. And then our doctor is going to also look at those chart notes and the records and see what is going on with this patient and determine if they are appropriate or not. We would have a program explanation first so they can learn about the program, see if it's a good fit for them. Once that is determined, then we're going to reach out, set up an appointment to have a nurse and a social worker come out so they get to meet their team and find out what this is going to look like.
Symptom management, medication management. We help them find the resources within their community if they have a resource need. So for example, if they need durable medical equipment, we might find some gently used equipment that they might be able to use in their home that maybe they couldn't get otherwise.
We are available 24/7. So your nurse might be making regular monthly visits, but outside of that, if you were to call after hours or on a weekend or with an urgency or a crisis, if you can't get a hold of your doctor's office, you can certainly call us, try to get a hold of your palliative care team. We have nurses that answer the phone after hours and on weekends. And the goal is to try to keep you out of the ER or urgent care if possible and manage those symptoms for you at home.
That's decided when they come out to do the admission appointment. They decide how much need they have. So in the beginning, it might look like a nurse coming once a week for 6 weeks, or a social worker once every other week, or once a week.
When they get there and they meet that family and that patient, what are the needs here? Maybe we need to come a little more often, and maybe we don't need to come as often. So in general, when we get that first referral, we have a basic idea that we think we're going to meet, but then it's up to the plan of care once they have met that patient.
Example of a service that they might provide is symptom management or medication management by the nurse. With the social worker, it would be resources and or mental health management.
Maybe the social worker is helping you with, I want to hire some in-home care. What does that look like? Who do I call? How is that paid for? And then the nurse could be doing these in-home visits and realizing, I've met this patient a few times and there's things that are working and things that are not. And they might actually call your doctor on your behalf and say, you know, I've met with this patient a few times. It seems like they're really struggling with this one medication. Maybe, doc, you could look at that.
When I go into the home to the family, they know ahead of time what the costs are because we present that to the families. And it is more limited by the insurances that pay for palliative care. Medicare doesn't pay for it.
Sometimes we have people on our service for a couple months and everyone's doing great and all the goals have been met. Sometimes people are on for a couple years because they're high complex needs and maybe they just really have a lot of issues that they're working on.
If we meet their goals, we're able to symptom management, we're able to keep them out of the hospital, or they graduate for some reason. Let's say that they beat cancer and they're healthy and they're on to their regular life, then they might discharge from our service or graduate from our service. It also might be appropriate if a patient becomes sicker, that they're more appropriate for hospice.
Thanks, Dawn and Kelly, for that insightful overview of home palliative care. We urge you to please reach out if you have additional questions or concerns. You can call us to schedule a no-cost phone conference, video visit, or a one-on-one consultation in your home. We know these are difficult times, and we're taking all necessary precautions to help keep any interactions we have with you safe and comfortable.
Willamette Valley Hospice and Palliative Care, we were the first hospice agency here. We've been here for over 40 years. We are definitely professionals and very skilled in what we do here. We're well known in the community, and it's very exciting that we were the first ones to bring the in-home palliative care program to the Willamette Valley. And we have learned over the ages and grown and gotten better and better, and we're always looking at opportunities to serve our community better and just keep moving forward.